a pipeline across the country, whether it was really something we needed to be extra worried about. Because all the environmentalists, all the different folks who oppose the Keystone Pipeline, they just preach about bitumen and how dangerous it is.
Well, I can't wait. What did the study say?
Here's the study, my friend, and this is just great news. The National Research Council, not some third-party political group, working for the Obama administration, the Secretary of Transportation, pursuant to this Congress's request that they study it. I've got the executive summary right here, and this just came out today. Here's what they concluded. And this is big news, because this is one of the reasons the President is against the Keystone Pipeline. It says, quote, "The committee does not find any causes of pipeline failure unique to the transportation of diluted bitumen. Furthermore, the committee does not find evidence of chemical or physical properties of diluted bitumen that are outside the range of other crude oils or any other aspect of its transportation by transmission pipeline that would make diluted bitumen more likely than other crude oils to cause releases."
Are you saying it's just as safe as the oil that goes through pipelines and hundreds of thousands of miles already across the United States of America?
I wish I could have said it that clearly. But the bottom line is, this isn't Tim Griffin saying it. This is the Obama administration's own study that we mandated they conduct. And I'll tell you, if you look at the arguments against the Keystone Pipeline that the environmental extremists have been putting out there, this is numero uno, number one, at the top. They've been basing almost their whole deal on this. And the Obama administration says, sorry, not backed up by the facts.
So we need to say, what's the holdup? What's the holdup, Mr. President? Mr. Speaker, we have got, again, I cannot emphasize this enough, and the whole point of this hour tonight is to say, based on that information and this new war on American families and American jobs, what is the holdup? What is the deal? This is 20,000 jobs, and we're just continually seeing this president, the president that's for the all-the-above energy approach, at every corner attack domestic energy production. I just don't understand.
In Colorado, the district that I represent, we do really have it all. We have a coal mine. We have wind energy, not only the wind farms, but we have wind energy manufacturing. We have one of the nation's most promising oil and gas plays right now in the Niobrara in Weld County. In western Colorado, we have thousands of jobs that are being created, and thousands more that could be created if government would get out of the way and approve the permits that they're holding back on. In fact, the Bureau of Land Management, if they were just to approve a handful of permits at the BLM waiting right now, could create over 100,000 jobs. That this country could put to work right now 100,000 people if these permits were approved. And so to hear the President talk about an all-of-the-above energy policy, and then to see his actions that go in complete opposite direction.
You know, I would almost rather the President just be straight up and say, you know, I only like some kind of jobs. And I don't like any of those kinds.
And I only like some kinds of energy.
Yeah, just be straight up with us, Mr. President. Just say, you know what, I got a war on coal. I got a war on the Keystone Pipeline. I got a war on natural gas and removing it out of the ground, slowing down permits. I like a certain kind of energy, and I'm going to try to fund it through the government. Just be straight up.
And let me just say this real quick as a reminder, Mr. Speaker, tonight's conversation is at #affordable energy, and so I just wanted to remind you, Mr. Speaker, that that's where we're having this conversation tonight alongside countless others. So just wanted to throw that in there as this conversation continues.
Well, I would also point out, and again, go into the environmental responsibility that we have. You as a mother, I'm a father of two, a 3-year-old and a 5-year-old. We all want clean air and clean water for them, and I would point out that Duke University last month, working with the University of Arkansas and working with the Obama administration's own U.S. Geological Survey, concluded that well water, they tested about 130 wells in Arkansas, something like that, that well water was not polluted by the natural gas extraction that's going on there. just more factual evidence that we can have the jobs, and if we extract the energy responsibly, we can take care of the environment at the same time.
And one of the most promising things about American energy development is not just the fact that it's creating thousands of jobs, but it's the side benefits of what the revenues that are produced, what that revenue goes to. In fact, in Weld County, Colorado, in my district, it's a county, probably the only county in the country that has zero bonded indebtedness because of natural gas and oil production. They don't have any debt. If they need a road, they pay for it. They pay for it with the money that they've received out of severance tax payments from oil and gas development. They got two companies paid their 2011 property taxes a couple months ago. $150 million these two companies paid to one single county. 40% of that revenue, 40% of that $150 million goes to the school districts, goes to the community colleges. And so not only are we able to develop affordable energy for the American people, not only are we able to put people to work, but we're also doing better things for our schools and our community colleges, because that revenue then turns around and goes to the core community institutions that make our country strong.
And let me follow up on that, if I might, real quick, because in one of my counties, when you take away the money that comes from Richmond and you take away the money that comes from Washington for education, 70% of the tax dollars in that particular county are derived from the coal and natural gas severance tax. You eliminate coal, they don't know how they're going to be able to fund their schools. So we're not just talking about, big business. We're talking about the schools and the classrooms and the students in those schools.
So it's a war on education as well.
Well, it's a war on everything that we hold dear when you get right down to it, because the truth of the matter is, when you're #1 nation in the world, everybody else wants to be where you are. Right now, we're #1 nation in the world. But this administration wants to throw away what has helped us get there, and that is an affordable, reliable energy plan. And we can't just throw it all out and expect to still have the standard of living that we have, and that means we won't have the money for education, we won't have the money for roads, we won't have the money for so many things that people think of today as just automatically being there.
Yeah.
But the money's got to come from somewhere, and it just can't come out of thin air. I'm sorry, Mr. President, money doesn't grow on trees.
So when it comes back to our responsibilities as Congress, this week we're going to debate and hopefully vote on the Offshore Energy and Jobs Act. And this is legislation that will increase production on homegrown energy, and it will drive down cost, and it will increase American jobs. And what it does is it expands U.S. offshore energy production in order to create over 1 million new American jobs, lower energy prices, grow our economy, strengthen national security, strengthen our communities by lowering our dependence on foreign oil. And the bill removes government barriers that block production of our own resources right here in the United States. And currently the Obama administration keeps 85% of our offshore areas off limits to energy production. 85%. And so this H.R. 2231, again, we'll be debating and hopefully voting on later this week, will open new offshore areas for that energy production and require the Obama administration, and again, Mr. President, who's for an all-of-the-above approach, require him to submit a new lease plan by 2015 for developing our offshore energy resources.
Well, and to the gentlelady's point, what a great opportunity for members in both political parties to work together to do something that can help create jobs for the American people. And you've talked about over 1 million jobs that could be created this week if folks on both sides of the aisle will just work together for some bipartisan, common-sense legislation that creates affordable energy opportunities and puts Americans to work. I'm sure this legislation will pass this week, but it's an opportunity for folks to vote for something that will actually make a difference. And I challenge folks in both parties to stand up and support this legislation. Now, the real hope will be whether the Senate will actually take it up. We've passed dozens upon dozens of bills that create jobs, that help put American people back to work, yet we still have almost an 8% unemployment rate in this country. I'll tell you what, I am fed up with Washington getting in the way of progress. At every turn, the solutions out of Washington are greater taxes, greater mandates, greater burdens on the American people. What we're talking about here is creating prosperity and opportunity for the American people to go back to work, to put food on the table for their families, and it's done through what is such a simple thing, domestic forms of energy that are right here at our grasp. Why wouldn't we utilize this energy that's right here in our country? It seems foolish and short-sighted, and frankly, it hurts the American people when we're not supporting domestic forms of energy. And so this week's a great opportunity for folks who say they're for job creation, who say they're for an all-of-the-above energy approach, to step up and lead and to join us in proposals that will put Americans back to work and help rebuild this country.
I totally agree with the gentleman, and we understand, and hopefully we can get more and more folks to understand that this body is not creating the jobs. We want the private sector to continue to create the jobs and lead. But sometimes the barriers to job creation and growing jobs in this country are barriers that Washington has put into place. And I find that a lot of the times when we're legislating in this body, we're not trying to create jobs to get in the way of the private sector. We go to people in the private sector and we say, what's your biggest hurdle? What's your biggest barrier? How could we help you grow more jobs? And more often than not, they'll say, get out of the way. And a lot of the bills that we put on the floor are to help Washington get out of the way. Move it out of the way and let the private sector continue to lead in this area. And I want to mention one more thing real quickly on optimism. If you study where we are as a country, whether it's with regard to the debt and regulation, some of these things, yeah, we got a lot of work to do there. But if you study where we are with regard to innovation, energy extraction, natural gas extraction, the low cost of natural gas, the companies that I mentioned in these articles that are moving from Europe, I smell nothing and I see nothing but optimism. The future of this country is limitless. And when I'm long gone, my kids that are 3 and 5 now are going to be living in a country, if we do things right, that just continues to grow and has all the energy we will ever need. And as an economist pointed out to some of us earlier tonight, if you're Russia and you're Saudi Arabia and you're looking at the innovation that has come out of American companies and you're looking at the deposits of natural gas and shale oil that we have in North America, you're worried.
And it is exciting, the energy future of this country.
Amen.
And when you see studies that are being done, that here's a study that I'll cite right here. It says, America's shale oil revolution is loosening the grip of the Organization of the Petroleum Exporting Countries on global oil markets, OPEC. Because of the work that we're doing here in this country, we're loosening the grip of OPEC. Daniel Yergin testified, a renowned energy expert, testified before the Energy and Commerce Committee talking about how the energy development in the United States is allowing our sanctions against Iran to work, that we're lessening their ability to sell and fund terrorism activities because we're able to produce it here in the United States, displacing around the world the sale of Iranian oil, the sale of Iranian energy. And so when our colleague from Arkansas talks about the optimism that we have in this country, the people of my district who see it each and every day in little tiny towns that used to have one stoplight, that now have a new housing development going up because of the production in the energy field, or traffic that they never had before because they've got activity going to and from the work site that never existed before. People who graduated from the local high school who for the first time in their lifetimes, maybe even their parents' lifetimes, know they can stay there in that hometown with their family with a good paying job and benefits because of energy development. We've talked a lot tonight about oil and gas and coal, but in Colorado we do have it all. We have wind energy and solar energy. And it's not just regulations that are blocking the traditional fossil fuels, it's regulations that are holding up wind energy projects. The ability to site a transmission line to get the power from the wind farm to the people who use it is being held up because of governmental regulations. And so there may be people out there who think that, you know, we're just down here talking about regulations on fossil fuels. But you know what? It's regulations that are holding up clean energy too. And if we truly cared about affordable energy, if we truly cared about doing something good for our country, which I believe we all do, and the American people are ready for it to happen, then we would get government out of the way and let America work, and our chances this week.
And that is one of the problems that we see in my district. I have a lot of counties that are really hurting. And it's not because we couldn't have jobs, it's because Washington is getting in the way, and every month we're having layoffs in some coal plant here or some coal plant there, or a company that makes things for the coal plant, or the railroad that hauls the coal, or the trucking company that helps move the coal. And so while they remain internally optimistic, it's really hard when that layoff slip comes to your house and you know that you're no longer going to be able to have that job. And that's why this war on coal affects each and every one of us, but it affects folks in my district maybe a little bit more because we're on the front lines and we're getting those layoff notices now. And I have people that I know who are casualties in the President's war on coal, and I'd like to hear from them at #AffordableEnergy, and I hand it back off to you, Madam Chair.
Well, I just want to thank all of my colleagues for joining this conversation tonight. And, Mr. Speaker, we'll continue this conversation at #AffordableEnergy. But the bottom line is this. While the President continues to promote his political agenda, we here in the House of Representatives majority are committed, as we have demonstrated time and time again, that we are committed to the all-of-the-above approach, and that this isn't, as you've heard from all of my colleagues tonight, Mr. Speaker, this isn't just a war on coal. This is a war on the American family and American jobs, and we are committed to getting government out of the way so that the American family and the American business can thrive. And with that, Mr. Speaker, I yield back my time.
The Chair thanks the Gentlelady and her colleagues. Under the Speaker's announced policy of January 3rd, 2013, the Chair now recognizes a gentlewoman from North Carolina, Mrs. Elmers, for 30 minutes.
Thank you, Mr. Speaker. I rise today to discuss the upcoming implementation of Obamacare. Prior to coming to Washington, I was a nurse for over 21 years, and I'm passionate about health care. My husband is a general surgeon, and he continues to practice in our hometown of Dunn, North Carolina. And I'm very, very proud of that. You know, a couple of years ago, when the President was proposing his legislation to basically overhaul health care in America, my husband and I became very active speaking out, and that was well before ever considering running for Congress. As a result, because of our passion and concern for this country and health care as a whole, I found myself winning my election and here fighting this fight. We continue with this fight, and we are 98 days away from the open enrollment process going into effect for Obamacare. This is something that the American people have been sitting back and watching for quite some time, and there are many, many questions that remain to be answered. You know, Mr. Speaker, a recent GAO study shined some light on some areas that we've been asking questions about for a very long period of time. Serving on the Energy and Commerce Committee, the Energy and Commerce Committee put forward a request to the GAO to find out where exactly are we in the implementation of Obamacare. This takeover of America's health care affecting 1/6 of our economy and affecting jobs across this country. It's the #1 reason today, Mr. Speaker, that employers are not hiring, because they're not sure of the effects that this will have once fully implemented. There again, this week, the Nonpartisan Government Accountability Office put forward their findings, and I just want to highlight some of those for you. States have yet to complete 85% of the required program activities. That means, essentially, Mr. Speaker, that only 15% of what needs to be in place at the state level for Obamacare is actually in place. Core functions of both federal and state-based exchanges have yet to be completed. With less than 4 months before open enrollment, any other missed deadline threats and timely establishment of exchanges. Exchanges are not in place, exchanges are not ready to be implemented, and yet we continue on this timeline path. HHS has not yet completed the critical steps needed to determine eligibility for credits and cost-sharing subsidies. So there's much groundwork that still needs to be laid and implementation figured out, and we don't even have those answers from HHS. Key data sharing agreements between the Federal Exchange and its federal and state counterparts are not complete. Consumer assistance and outreach activities to individuals and employers has yet to be implemented and has been delayed. It cannot simply be a political campaign on the road touting the virtues of Obamacare that will implement this program. This is a major, major concern for all of us who know how important health care is. You know, I can go on. There's many more pieces to the GAO report, which basically cites the fact that CMS is not ready. CMS is supposed to come in and help the states that haven't implemented yet or aren't ready. Where are they? They're not there. They're not acting. We have these questions, but who does this affect? What are the questions that need to be answered? You know, this afternoon I had the opportunity to go to National Children's Hospital, met with some of the families there. Very ill children, children dealing with diabetes, cancer. I got the opportunity to see a 1-year-old who's waiting for a heart transplant. These are the children that will be affected with the implementation of Obamacare. Why? Because research will be affected, because life-saving cures and treatments will be affected. How can we implement a health care system that no one at this point can actually state will improve the quality of care of our health care system? It's very important that when we talk about health care and the takeover of health care, that we separate the two issues. One, health care paid for, health care insurance, health care coverage, and then health care itself. They both suffer as a result of Obamacare being implemented. We simply cannot stand by and allow this to happen. My colleague from Kentucky is here this evening as well, and he has some words, and I yield some of our time to the gentleman from Kentucky.
Thank you. I thank the gentlelady for yielding. And it seems there's no shortage of red flags regarding Obamacare. The one-size-fits-all health care law is proving to be disastrous for consumers, for employers, and health care providers alike. Just last week, as my friend from North Carolina said, the Nonpartisan Government Accountability Office warned that because government officials have missed multiple key deadlines to set up the new health insurance exchanges, there is serious concern that the exchanges will not be ready in October as scheduled. Employers and families across Kentucky have expressed serious concerns about meeting the requirements of the law and wondering if they will lose their coverage, be forced to choose different providers, or be saddled with enormous new costs. Now these individuals are left with even more uncertainty. When talking with business leaders across my district, I hear a barrage of questions and concerns. Small businesses, the backbone of our economy, are likely the hardest to be hit. Some local insurers say the law could put them out of business. One restaurant owner says it will be a challenge for the whole industry, and many will be forced to lay off employees. Others simply say it will be difficult to insure all of their existing employees. A Gallup poll released last week showed that 41% of small businesses, the engine of our economic growth, have stopped hiring new employees because of Obamacare. The same poll also showed that 1/5 of those surveyed have reduced their workforce because of the law. Citing the uncertainty, these business leaders don't know what types of insurance programs they might be able to implement or if they will have to alter the shape of their workforce. And the uncertainty seems likely to continue given this striking but not surprising report from the GAO. The Government Accountability Office warns that the Center for Medicare and Medicaid Services still has many duties to complete across core exchange functions, including eligibility and enrollment. With enrollment less than 4 months away, these missed deadlines will likely result in even more confusion as Americans are prepared to be placed into the exchanges. It's no wonder that this law is so wildly unpopular and individuals fear being placed in the exchanges. But it's not just families and business owners who are left in the dark. Insurance companies don't know what to plan for when the exchanges open, and some are already fleeing the market. Aetna recently announced they will not participate in any statewide exchanges, and they will exit the individual insurance market in California entirely. This move could set a dangerous precedent, insurers not being willing to take the financial risk to meet the demands of Obamacare and not participating in the exchanges altogether. With competition dwindling and individuals not knowing what they can expect in terms of coverage and costs, we are left with a very scary and unacceptable reality. There are simply too many unknowns in a law that completely overhauls our nation's health care system. This has led to unintended and negative consequences for employers, patients, and providers. This law is not the solution to our nation's health care problems, especially given the lack of information and tools available for implementation. Instead, we need to enact a patient-centered plan that lowers costs and ensures access for all Americans. And I'll yield back to my friend from North Carolina.
Thank you, Mr. Speaker. I'd like to yield a couple of moments to my colleague from Georgia, Mr. Woodall.
For what purpose does the gentleman from Georgia seek recognition?
Mr. Speaker, I send to the desk a privileged report from the Committee on Rules for filing under the rule.
The clerk will report the title.
Report to accompany House Resolution 274, resolution providing for consideration of the bill H.R. 1613 to amend the Outer Continental Shelf Lands Act to provide for the proper federal management and oversight of transboundary hydrocarbon reservoirs and for other purposes. Providing for consideration of the bill H.R. 2231 to amend the Outer Continental Shelf Lands Act to increase energy exploration and production on the Outer Continental Shelf, provide for equitable revenue sharing for all coastal states, implement the reorganization of the functions of the former Minerals Management Service into distinct and separate agencies and for other purposes, providing for consideration of the bill H.R. 2410, making appropriations for agriculture, rural development, food and drug administration, and related agencies programs for the fiscal year ending September 30th, 2014, and for other purposes, providing for proceedings during the period from June 29th, 2013 through July 5th, 2013, and for other purposes.
Referred to the House calendar and ordered printed.
Very much thank my friend from North Carolina.
The gentlelady from North Carolina may proceed.
Thank you, Mr. Speaker. Continuing our discussion about the implementation of Obamacare, I think it's important, as my colleague from Kentucky has cited, that back home in his district, many businesses, many individuals, many families are being negatively affected as this moves towards implementation. Tomorrow, in the Energy and Commerce Subcommittee on Oversight and Investigation, we will be holding a hearing that actually discusses the challenges facing our American businesses. Back in my district, and actually here testifying tomorrow, is one of my constituents, Mr. Steve Lazinski, who will be here with his wife, Kathy. And they actually own a business, Sparkle and Shine Cleaning Services. It's a family-owned business. It's based in Apex, North Carolina. And Sparkle and Shine was started in 1998 with one employee, and today provides over 240 employees. Put simply, Sparkle and Shine cannot afford the $2,000 per employee fine attached to Obamacare if my friend, my constituent back home cannot provide the health care coverage. He employs low-income workers. They're entry-level jobs. They're hard workers. Many of these individuals are actually served time in jail and are now on a second chance at life. Mr. Lazinski and his wife Kathy have given these individuals a second chance. And now their jobs are in jeopardy because of this devastating health care law. And to my colleague again from Kentucky, I'm sure that he also has many, many stories to share.
Well, we hear stories like that all the time when we're home, and we had one in the Energy and Commerce Committee when we had a gentleman who had a chain of restaurants he's developing in New England, which isn't where I'm from, but he was in before the committee, and he said he had 8 restaurants and then planned to, this is his testimony, to open a 9th. And he decided he had to wait because he has no idea what this health care bill is going to cost him when he has to provide health care for his employees. And he said that of his net income of his 8 restaurants, he estimated, if he can come up with it, because as we know, you still don't know exactly what the health care bill is going to look like, or health care. We know what the bill looks like. Well, we don't know what's really in it because the rules have not come out to say what you have to provide your employees. And this is supposed to happen in October and be ready for January 1st. And so he's decided just not to open a restaurant until this gets implemented so he can move forward. And he said it's going to take half of his net income, what he's estimated if what's in the rules come out, half of his net income. And net income isn't, if you've ever been in business, something you always take home. If you're growing a business, hoping to open a 9th, 10th, and on restaurant and create a chain, net income is what you put into the business to grow the business and move forward. And half of his net income, according to his estimates, as best as he can estimate, because nobody knows the details of what's actually going to be required until hopefully we'll see it before October the 1st. And it's just frustrating for him. It's frustrating for people. It's frustrating for employees. And a guy stopped me in a store the other day. He just got a job at a retail store, and he said, I was promised 40 hours. I was just told I'm going to be working 29 hours. And that's a new class of people working, particularly in retail. It's kind of he was retired, and he was kind of looking for extra income. He's going to be a 29er. And that's a term that we hear quite a bit. And so it's dealing with health care is something we absolutely have to deal with. Dealing with it in the way that this bill that didn't cut costs, it didn't try to cut costs. It actually implemented even on top of the system, even more, that's going to cost more. And employers are really concerned about, not about being able to cover their employees, they're concerned about they're going to be able to afford to stay in business and they even have employees. And that's the concern most of them that I hear talk about. I'm sure you hear the same, and I know our good friend from Texas is now here on the floor, and I'd like to give back to my friend from North Carolina.
Thank you. And just to follow up on some of the remarks that my colleague has made, getting back to the issue of jobs and job creation, there's a recent Gallup poll out this week that found 41% of small businesses have stopped hiring because of Obamacare. That is a staggering number. And to the point of good patient-centered health care, that is not what Obamacare will provide. In fact, the CBO has estimated that 31 million in 10 years will still remain uninsured. So what are we doing? Why are we creating this system that will be broken from the start, that we will only spend hard-earned taxpayer dollars trying to fix in plenty of time, and who will go without the good patient-centered health care that every American deserves?
I'd like to point out what you said. When I was here, you weren't here. I don't think you were here when we were debating the Obamacare. And I
was at home watching the TV, ready to put my foot through it.
Well, but when we were debating it, the number was always 40 million people uninsured. We're 40 million uninsured. So we completely upended the health insurance market, put all this uncertainty into the economy. I think it's the biggest drag on the economy now. While we haven't had growth, and we're going to have 31 million uninsured. But that's not even by a partisan group. That's a nonpartisan Congressional Budget Office. We have 31 million people uninsured. So all of this, because we had 40 million uninsured, and after all of this, 31 million uninsured. So did we get our $1 trillion worth?
That's a wonderful question. I have another constituent that has shared numerous times with me his concern for the implementation of Obamacare. Gerald and Tilia Kivett from Clinton, North Carolina, owned, again, family-owned business started by his father back in the 50s. This company makes church furniture, church pews for synagogues, funeral homes, churches. Gerald and his wife are so concerned about this mandate and wanting and needing to avoid this government mandate. It makes it extremely expensive for him to do business. He, at one point, had 160 employees. He is now down to about 45 employees. And in order for him to, as you can imagine, to continue to do his business in the way that he sees fit, the way that was started by his father, how will he continue into the future to be able to do business when he knows that working his way back up again in this awful Obama economy, for him to hit that 50th employee will mean penalty for him if he is not providing health care coverage for his employees. And if he is able to provide that health care coverage, it will be devastatingly expensive. To that, I would like to welcome my colleague from Texas, Congressman Burgess, for a few comments as well, as he is well-versed in health care and again, the devastation that Obamacare will bring.
Well, I thank you for yielding. I really thank you for bringing this important topic to the floor tonight. Look, we're 6 months and 6 days away from the full-on implementation of the Affordable Care Act. We're 3 months and 6 days away from the open enrollment period, October 1st. You know, I just can't help but feel it's like a fast-moving train charging down the tracks, moving toward a head-on collision with the American economy. And it's going to be the small business that suffers the devastating effects of that head-on collision. We've had opportunities to talk to the people from the agencies to the extent that they will. I'm worried. I don't see how they can have that federal hub up and running by October 1st and have it work the way it's intended the very first time, especially if they don't have time to test it before they turn it loose on the American people. Very worried about what the world is going to look like after January 1st. I got to tell you, from the standpoint of a practicing physician in a small practice, we had 5 doctors in my practice. I can just tell you, well, look, remember when Part D came? Well, maybe you don't. I was here January 1st of 2006. It was rough for the first several weeks. But there we're talking about the prescription drug benefit for seniors on Medicare, maybe 42, 45 million people out of 310 million people, and just talking about the prescription drug benefit, and that was difficult to implement. There were pharmacists all over the country that basically did not get paid for the prescriptions that they filled for a month to 6 weeks. Now, they were able to keep going because they had other prescriptions, they had other business going on in their pharmacies. But this is going to be everything, from tonsillectomies to childhood vaccinations to ER visits. If the cash flow is disrupted even for just a few weeks, the small business which are medical practices in this country will have a very, very difficult time enduring. But more importantly, and you all have correctly addressed it, it's the 29ers and 49ers in this country. The people who are scared to add one more than 49 people to their employment rolls, or the people who have had their hours now cut to 29 hours a week so that they will not require a health care benefit. It wasn't the way it was supposed to work. The gentleman from Kentucky nailed it right off. The people of America in 2009 were saying to us, whatever you do, don't mess up the system that's working for 65 or 70% of us. The other thing they said was, if you're going to do anything at all, please help us with cost. And what have we done? Exactly the opposite. We've messed up the entire system, and it's becoming more and more apparent every day. And if you don't believe me, wait till a year from now. Wait till 16 months from now, and just see how bad it is. But the other thing is, we didn't do anything to help with cost. If anything, we've made it worse by ratcheting up the demand side, not increasing the number of providers. We've guaranteed that prices are going to go up, not just next year and not just the year after that, but for every foreseeable year in the future. And I know that's hard for people to estimate. I know the Congressional Budget Office can't give us a figure on that. But, you know, just do the arithmetic yourself in your head on the back of an envelope, and you'll be able to see that we are headed for a significant disaster. Now, it's all well and good for me to criticize the administration and the way they've implemented this, but I got to ask, where are our Democratic colleagues? Where are the solutions that they're offering? Clearly, we should do something to help a small business who is having to restrict the employment hours to 29 a week. Surely we should do something to help that. Where are the solutions from the other side? They're non-viz. They're non-existent. We should do something to help that small employer who wants to grow beyond 49 employees but is now frightened to do so. Where are our Democratic counterparts? Where are the people from the agencies coming to our committee talking to us about how this might be managed or maintained? Why aren't they talking to us about their contingency plans? You know they've got them. You know they're over there at the Department of Health and Human Services right now talking about what if the federal hub doesn't work? What if it doesn't work the way as intended? We'll have to have a way of narrowing the scope, of confining the number of people we bring into this new Obamacare environment. But they won't talk to us about that. The Democrats won't come forward with any solution. We're doing what we can to bring people's attention to this very important topic. Yeah, to some it may be complaining, but if you don't think about it, you can't prepare. And if you're not prepared, it is the unprepared person who is really going to suffer in this new environment that, again, is created in 6 months and 6 days. I do thank the gentlelady for bringing this topic to the floor tonight. I think it is important that we continue to talk about it. We continue to talk about our ideas and our solutions, and there are many out there. And people need to assess for themselves, how will I be best served in this new environment that's brought by the administration? Or perhaps is it not too late, or perhaps there's some things we could do to alter that course, to move it off of that center of destruction where it's aimed right now. I thank the gentlelady for having this tonight. I'll yield back.
Thank you to my colleague from Texas. His, again, insight on this very, very important issue is vital to coming up with the solutions that we need. You know, I do want to touch on one of the points that you were making, Dr. Burgess. Basically, I saw a report this morning put out by the Republican Study Committee that basically said that there was a study that's showing 30,000 doctors. We will have a shortage of 30,000 doctors within this country in 2 years. That is devastating.
Well, if the gentlelady will yield on that point, and you know, you're in a medical family, I know because I hear it everywhere I go, and physicians all across the country are concerned. They don't know what they're getting into. They don't know what the world will look like. As a consequence, like anyone else, they are reluctant to make those big decisions. They're reluctant to hire a partner, buy a new piece of equipment, open a branch office. They are, like everyone else, are in that hunker down mode where so many small businesses have been for the last 4.5 years. But without expanding the provider corps, without expanding the health care manpower, you can pretty much predict that there is going to be a price spike, because you know you're ratcheting up demand by increasing coverage, and at the same time you're not providing for areas where those people can be seen. But then the other thing, and what's really unfortunate, by some of the means with which coverage has been expanded, we already know that there are places in this country where it is hard to get a new patient appointment if you are a Medicaid patient. The reimbursement rate is so abysmally low that a provider can't possibly keep their doors open if they accept those levels of payments. So as a consequence, they don't. Well, what are those patients going to do? They do what they've always done and gone to the emergency room, which is the highest cost point of contact care that you can have. So instead of solving a problem that every Democrat here talked about 4.5 years ago, instead of solving that problem, we've doubled down and made it worse. And again, as a consequence, the cost of care is going to go up. Providers are going to drop out just because the frustration is going to get so high that it will just simply not be worthwhile to continue in practice, or you'll go work in a practice environment where I just simply don't have to put in the number of hours that I would in a solo or small group practice. But we've really selected against those practitioners, those men and women who go to work every day early before the sun comes up and they work till after the sun goes down taking care of their patients. We're actually self-selecting against that very type of individual that, you know, we all knew, we all grew up with, we all look to as our leaders in the medical profession. It's been very, very difficult for those people to endure. We'll look to academic medical centers, perhaps to hospitals, perhaps to the government itself for that leadership, but it's not going to be the same thing. I yield back to the gentlelady from North Carolina.
Thank you to the gentleman. I do want to take a moment to talk about another group of young individuals in this country, young Americans, who are also being negatively affected as a result of the implementation of Obamacare. Our students. our students who are paying back student loans. As we all know, July 1st, student interest rates are scheduled to double, essentially. And I think it's interesting, my staff and I have done some research on this, and if you all remember, back in 2009, when President Obama was implementing the health care bill, they also took over the student loans in this country. That was for pay-for. And according to the Congressional Budget Office, over the next 10 years, $8.7 billion of that student loan payback will come from those student loans. So not only are we affecting health care in this country, but we are also affecting our young people, those individuals who are graduating from colleges around this country who may or may not have a job to go to, a job that they have prepared a career for, and yet they, too, will be paying for Obamacare. And I would like to yield.
I think that's a great point, because I brought that up when we were debating it back in 2009. And what people don't realize, and it didn't get a lot of coverage, Mr. Speaker, is that the federal government took over the student loans. So you're going to hear a lot about student loans in the next few days, because after July 1st, student loan rates are going to go up. The House is active. We passed the bill. It's in the Senate. I've heard the President talk about it. But what people need to realize, when the health care bill passed, as my friend just said, the federal government can loan money at a low rate because we can pretty much borrow from ourselves at a low rate. And when we loan it to students, they pay the little over 3%. And the difference, the float, comes back to the federal government, the profit from loaning to our businesses. You know where $8.7 billion of that is going to pay for the health care bill. Instead of taking $8.7 billion and giving it back to students who are struggling with affordability of college, that's what I'm in that world right now, because my son's leaving this summer to go off to college. I have a daughter in college, and so most of the people that are peers of theirs or that I see, we talk about the affordability of college. Well, one of the things that we did, we took money that students are paying back on their student loans to pay for the health care bill. Instead of rebating it back to the students, letting them put it in their pockets to pay their loans, it goes to the health care bill. So as we hear a lot of people on the other side and in the White House this week talk about health care, and the Senate hasn't passed a bill to deal with student loan interest rates that go up, I want people to remember, Mr. Speaker, I want people to remember that $8.7 billion of what people are paying back in interest is going to fund the health care bill.
And with that, I would just say the good news for the House is last month we passed the Smarter Solutions for Students Act, and now it lies with the Senate for passage as well. And with that, Mr. Speaker, thank you very much, and I yield back the remainder of our time.
Gentlelady yields expired. Does the lady have a motion?
I have a motion that we do not adjourn.
The question is on the motion to adjourn. Those in favor say aye. Those opposed say no. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow for morning hour debate.
So the House has gavelled out, but members return tomorrow at 10 a.m. Eastern for morning hour speeches and noon for legislative work. Later this week, work on 2 offshore oil and gas drilling bills, including one dealing with drilling along the U.S.-Mexico boundary in the Gulf of Mexico. Live coverage of the House continues when members gavel back in on Wednesday.